Hey guys, so in the video that you saw, the 360 video of the inside of an ambulance, one of the things that you saw was the first in bag. And I'm going to take a few moments and guide you through an example of what a first in bag is about. This is something that you need to keep in mind, that each first in bag has its own selection. Each department essentially selects what it is that they would like in their first in bag. Some of them are going to have multiple bags that they're going to take in. The one that we're going to look at now essentially handles the first 10 minutes of a cardiac arrest, and we'll explain some other things a little bit later on. But again, when you go to do your rotations through a field ambulance service, we want you to take some time and learn about the equipment. This is the best way to learn, is to grab a piece of the equipment, go through it with your preceptor, and then you will then have the ability to take a look at this information and apply it, right? We want you to be able to apply a lot of this information, okay? So one of the first things I want you to take a look at is going to be a safety device or a safety feature. So on all of the first in bags that are necessarily here, this is going to be one that is called the CO monitor. Now, this CO monitor is attached to the first in bag, and hopefully you can see that the numbers change. It goes from CO and it says that there is 0. So what this is doing is continuously monitoring the air. And anytime that this bag goes into the residence with the crew, it is monitoring for CO. In the event that it has detected 35 parts per million, it will emit a low-level alarm, and when it reaches 50 parts per million, it will go to a much higher alarm reading. So when you hear this, if it goes off, your first indication is to leave. And if you can take the patient with you, fantastic. But again, this is a personal safety device that our department that I am going through this bag with has chosen to place this on all of their first in bags, so that it is for more protection of the EMS crews as opposed to the patient at this point. All right, so let's dive into the bag. The front compartments that we're going to utilize here, you can see the way that the bag is facing. This is going to be the front compartment. We have several rolls of different size tape. We also are going to have some conforming dressings, so some gauze. Basically, these are things that you're going to learn from the bleeding control and shock management type areas of your EMT or EMR book. So this is where we're going to be talking about bandaging. We also have, this is going to be a nose clip, and the nose clip is being utilized to help control nosebleeds. So this is going to go on the bridge of the nose to try to help control that. Additionally, we have some of our Insta-Glucose, and because we are in Pennsylvania, Pennsylvania does require that we carry 3 of these that are readily available. And as you can see, we have 3 that are immediately inside the bag. Now, one of the neat things that Pennsylvania has also allowed is that because of the cost of some of these, they have now gone to the point of allowing the use of cake icing, so something that you would buy in a grocery store, to be utilized in place of the Insta-Glucose. We also have a pen light that we're going to be able to check pupils with, and also gives you a nice little pupil gauge to try to figure out where things are at. If you keep an eye on right about the area of about the 5mm is where you're going to find that an eraser. So an end of an eraser from a lead pencil would actually be about that same size. And excuse me, one of the things that I would consider very important is going to be an Emesis bag. Here you can see it as listed as a vomit bag, but we'll call it Emesis. And this is one way. So if they throw up and go into that bag, it's not going to essentially come running back out. Of course, we have to have our pair of trauma shears. Now, just to give you an idea, I personally carry my own set of trauma shears. This is a different brand. These are Leatherman Raptors, and I really prefer to use these. They work very well. It's more of a multi-tool. But again, trauma shears, you do need something to be able to cut some clothing off, bandages, tape. You may be cutting splints as well. Other things we're going to find in here are going to be multiple pads, such as the 2x2, 4x4 gauze pads. There's going to be things in here that we call ABD pads, and ABD pads are going to be very similar to just very absorbent pads. Okay, so we'll take a look at our next compartment. All right, so our next compartment, and I just rotated the bag over this way towards the left, and we have a couple things that is in here. So we have a regular stethoscope, and just to keep in mind that this here is a double tubing, and it is up to each individual as to what you want to do, as to whether or not you want to use a single or a double. We also have a manual blood pressure. This is for a regular adult, and the regular adult blood pressure. One of the things we need to keep in mind is that as long as the needle is between this nice little oval that is in here, it indicates to us that the blood pressure cuff is considered to be certified or actually have been calibrated correctly, and is just inside. So this is one of those things that we would have to continue to monitor, and probably need to replace this cuff very soon because it's almost out of calibration. Not an unusual thing for things that are inside of a bag that is moving quite frequently. Another one is this service also carries a pediatric one. Again, this is just a smaller blood pressure cuff, or you will hear people refer to it as a sphygmomanometer. And yeah, I did get to say that. And the blood pressure cuff again here is just going to be smaller. It's designed for pediatric patients. However, because of the size of it, we can also utilize it in children as well as some geriatric patients who may be very small. So again, continuing to turn the bag, and we're actually turning the bag here counterclockwise. Take a look at a few more things that are in here. Here we have a CPR mask. So this does serve a great purpose for us for multiple reasons. Not only, you know, if you're performing essentially one person CPR and you're following through the American Heart Association guidelines for 2015, you know, or even earlier, it indicates you're probably going to be ineffective in performing one person CPR with a bag valve mask. So that's why one of the reasons why we'd have a CPR mask in here. This way, if there's something else that is ongoing, or we need to rotate that out with a somebody else, you know, a first responder had gotten there, we can just rotate that out and give them that one, and we can dispose of the other one. This is a SAM splint. So again, SAM splint is a type of splint, or is a brand of a splint. This is a more generic type one, but this is a formable splint. So here you can see that this is rolled up. It's already in its plastic. We would just disconnect this, and we can actually form this. This will work for a foot. This will also work for your arm as well. And recently was on a call in which we had to utilize two of these to secure both a radial ulna fracture and a potential humeral fracture. So, and the patient was laying face down or in a prone position. We also have here our instant cold packs, and we also have a instant hot pack. So we do have the ability to actually apply some heat as needed if the patient is hypothermic. And we also have a patient who may need to have ice applied to a fracture or some swelling that may have occurred as a result of some type of traumatic injury. As we continue to go through here, we'll find out that this is one of two tourniquets that we carry, and this one is actually, they're both the same. These are both considered to be M80 tourniquets, and the way that they work is that you will apply the tourniquet to the limb, and then you will twist this little window, or this little knob, and you will continue to tighten it until the bleeding has stopped. And then you need to check for a pulse to make sure that there is essentially no pulse there. And we do carry two in our first in bag, and most providers, including myself, do carry one on their person, and that is to assure that not only can we help hopefully protect ourselves, but, you know, protect our partner as well. So this is one that I carry in my pocket, and this is just different version. But again, you know, it is readily available and it's primarily designed for use by me in the event that something happens. A couple other things that are in here. We have Quikclot. This is a anticoagulant type dressing. So basically, we'll call it a hemostatic agent. Yeah, I've kind of, you know, froze up a little bit there, but this is a dressing that does come with an expiration date. And as you can see, this one expires 9 of 20. So we're still doing pretty good here because we, at the time of this video, it is not 9 of 20. And these are roller gauze, and we have switched from using 4x4s of these to the roller gauze so that we can actually get into more of the packing of the wound. And this has really helped out quite a bit in the event that we have to pack a wound. We also carry 2 triangular bandages inside of our first in bag. And the idea of the triangular bandages is that, you know, you do need to at least have 2. And if you're using these primarily for a sling and a swath. So you would be able to use this for a sling and a swath. And this would work great for anybody who has a shoulder dislocation, or you have had to splint a radial ulna fracture, or potentially even a humeral fracture, because you want to make sure that they're not going to have a whole lot of movement. Okay, so we'll put this away and we'll move on to the next compartment. So our next compartment, again, continuing the rotation, this would be the last outside compartment. This is going to be our glucometer. And our glucometer is set up so that we can check on anybody's blood glucose, as it is necessary for anybody who has an altered mental status. One of the things to keep in mind is that this is a patient assessment tool. This is one that if you have a patient who has an altered mental status, you will definitely need to make sure that you use the glucometer. Okay, and we'll let another video go to be able to identify how to be able to use the glucometer. Okay, so we'll put that back and we'll move on to the inside compartment. All right, so we're going to continue with the inside of our first in bag. Okay, so since this one is just kind of like sitting right here and staring us in the face, this is going to be a sharps container. And our sharps container here is going to be one that we can use for, it fits well in our bag, and you can see it turns upside down. And when it does that, it just keeps everything in place. So that means that on the side, we're going to have to press, and this will open up, and then we can put all of our sharp containers, or our sharp instruments, such as needles, inside here, and then we can dispose of it properly once it has reached its full capacity. Another thing that we would find straight through this compartment is going to be, and we'll just move this off here to the side, is going to be our bag valve mask. So our bag valve mask is already inside of a package. And we have had individuals that, you know, we may have to open this up and make sure that everything is together, or at least look at it from the outside. And here we can see that we have our oxygen supply tubing. There is a reservoir bag that is there. And over on this side, we do see that there is a mask that is available. So we have a medium mask, and we also have the bag valve that is here. And again, as you go through class, you will learn more and more about the bag valve mask, but very important piece of equipment. And this is something that really saves a lot of lives, because people are not going to be breathing very well a lot of times that we run into them. We also carry another device. We carry a secondary pulse ox in addition to the one that is on our heart monitor. But this is just another one. We have decided not to get rid of it because, you know, we already had them. And sometimes if it's not broke, don't fix it. But it gives us the opportunity to also use it as a backup. And we have had to use it before. So as you can see, you just turn this on and we put the probe onto the patient's finger. This is going to be more of a spring probe. And you can see that once this is placed on, it should go on a ring finger of the non-dominant hand. It can be covered up. And as you can see, we have color changes here. This has now gone to a green, which is telling us that essentially we have a great pulsation. So this is like looking at our pulse waveform, which we'll see later when we get into a heart monitor. And it's also giving us a heart rate and also giving us a pulse oximeter. Yes, I am an asthmatic and my pulse ox sitting at 95%. Probably not too bad today. Feel a little tight today, but might need to take my inhaler. And the pulse rate, yeah, a little too much coffee today, but hey, you know, that's what EMS is about. Living with coffee sometimes. We also carry, from the ALS standpoint, we also carry a bag of IV fluid. And again, there is another video that you can take a look at on how to set these up. And we want to make sure that the bag is not expired and it is still good right here with the date that we're dealing with right now. Okay, so over here we have, and I'm not going to open this up, but we also have, this is our basic Airway Kit, and we have our oropharyngeal airways, our nasopharyngeal airways, and we also currently are running our King LTs in here. And while this may be used for, you know, we call it the basic kit, mainly because we don't have any of the intubation equipment in, but the King Airway is not approved for use for the EMT level. It can be used for the advanced EMT level, but not currently for the EMT level. Okay, so that is also in there. And then finally, one of the final things in here is looking up here on the top. This is going to be a multi-trauma dressing. It's a very large dressing to enable us to place some pressure on a lot of different wounds that may be taken over an entire chest or an abdomen. And we can also use that in the event that we have maybe an evisceration where there's some organs that are protruding out. One of the last things, and I was just looking for this, this is, before we get in there, this is our drip set that is in relationship to our IV bag. So these two things will essentially go together. We'll move that off to the side. But we also have a med bag. And the med bag is actually inside of our nice little stat pack here. When we open that up. So a lot of ALS medications, and this would include our nebulizers. So here we have albuterol, which we, from the EMT standpoint, we will talk about the use of albuterol, but it's also very important to make sure that you're taking a look at some things, because we have albuterol here, and then we also have ipratropium bromide and albuterol, which is also known as duoneb, and they are very, very close. You can see that there's a difference in color, but not a whole lot, so it's very important that you make sure that you're utilizing the rights of a medication and you're reading through all of your material. We have, these are our saline flushes, so anytime that the advanced level provider establishes an IV, this is something they're going to flush through. We have additional IV drip set. And when we open up this inside compartment, we have our drugs such as, this is epinephrine. So we have 3 epinephrines for cardiac arrest. We have naloxone, which is very popular right now. We also are carrying verapamil so that we could use it to help control heart rates. And we also have atropine that is also available in here, and this is going to be used for essentially some slower heart rates. We do carry our chewable baby aspirin, and then we also carry what is going to be referred to as the D10 or the 10% dextrose. And with this, along with the IV drip set, we can put those things together for the ALS provider to administer dextrose as needed. In addition, we have some other medications that are available, including additional syringes that are going to be right over here. Okay, so we have additional syringes that are sitting in here, and we have IV needles, or hypodermic needles, I should say. We have adapters. Here's some nitroglycerin. Here are some other medications, and you can see as they are all just very well kept in an area. And what we try to do is to make sure that those things are going to be kept in an area so that they can't get mixed up. As you saw earlier, it's very simple to just go grab for something and find out that it's the wrong medication. So it's very important to read. And we also go through a double check, meaning that we want one person to check it, and we need it to be verified a second time. That may be by another provider, or it may also be by the patient. Because if the EMS provider is in the back of the ambulance by themselves with the patient, then we need to make sure that they are also going to be able to be verifying that the medication that they're receiving is going to be what they told us it was going to be. All right, so our last thing that's inside of our first in bag, and that is going to be our IV container. So this is primarily designed, and at least in our service, this is really a paramedic specific product. But we have different types of angio needles. So it is going to be smaller needles, and the higher the number, the smaller the needle. So we have a couple of those. We also have some tape. So here's paper tape in the event that somebody is allergic to some of the tapes that we're currently using. We also are going to have other regular tape, and this also includes a couple tourniquets that we have here. And the tourniquets are not going to be the tourniquets that we would use for bleeding control. These tourniquets are going to be designed for venous tourniquets, meaning that we would need to get the veins to come up. So as you can see in my hand, there's a couple of them that are there. We need them to come up a little bit more, and we just put a tourniquet on. We have alcohol preps. We have Band-Aids. We have a syringe. These are labs that we can use to obtain some blood labs for the hospital. We also have 2x2s. We have a transparent skin dressing to help secure the IV site down, as well as some flushes, and these are our extension sets to be able to make a basically just an IV lock. Okay, so again, that's pretty much it for our first in bag, and hopefully this was informative. And should you have any questions or realize that there's some things in here that we need to take a better, deeper look at, such as the glucometer or getting IV supply set up, there are additional videos available for that. So please make sure that you check out the YouTube page and find out more information. Have a good one.